getting up more at night, or your flow is slower and it takes you longer to pee in the daytime, or perhaps things don't work as well in the bedroom as they used to. Is this just part of getting older and part of the natural aging process? Or does this mean that you should go and see your local doctor or potentially go and have a chat with a urologist? Hi, my name is Dr. Charles Chabert. I am a urologist and director of the Prostate Clinic located on the Gold Coast in Australia. In the following video, I'd like to highlight for you 5 reasons why you might need to see a urologist to discuss matters and have things assessed in a more complete way. As always, if you get benefit from the video, give it a thumbs up, like, subscribe. And also, if you've got comments or questions about what we discuss in this video, leave it in the comment section down below. So, number 1, as we get older, there are without doubt changes to the way that we pee. This, for most men, is related to a benign enlargement of the prostate, which we call BPH, or benign prostatic hyperplasia. In essence, the prostate is a small gland. It sits underneath the bladder, shaped a bit like a donut, and as it grows, it progressively obstructs the outlet pipe of the bladder and makes it harder for men to pee. One of the challenges that I see in my clinical practice is that because the prostate grows very slowly, changes that it causes happen gradually, and men adapt to a new norm progressively with time. So just be aware, think, how many times are you getting up at night? And is this similar to what you did last year or the year beforehand? Do you notice that it takes you longer to pee in the daytime, or are you rushing to get to the toilet, sometimes getting caught short? If you are experiencing any of these things, please go and see your local doctor, have a discussion, maybe go and see a urologist to have this evaluated further. Reason number 2 is if you see blood in your urine or if you see blood in your ejaculate fluid. So seeing blood really is not normal. And if this is the case for you, this really does require further assessment. Blood in your urine is a hallmark feature of having a polyp somewhere in your urinary system. The most common place for a polyp is inside the bladder, and really any assessment that we do to explore hematuria or blood in your urine is geared at making sure that there is not a polyp, and if there is, that we deal with it accordingly. One of the challenges that we have with hematuria is that it can be caused from anything from a benign enlarged prostate, potentially prostate cancer, yes, a polyp in the bladder or anywhere in the urinary system, stones somewhere in the urinary tract, or potentially an abnormal growth in the kidney. So blood in the urine always needs to be assessed. Hematospermia, or blood in your ejaculate fluid, again, is a hallmark feature that needs to be assessed. Now, for the majority of men, it will be related to a benign enlargement of the prostate, and a small blood vessel in the gland can tear and split, and that can be the cause of why men can see blood in their ejaculate fluid, but there can be more sinister causes for this, and it does require assessment. If you'd like to be part of our growing community, please follow the link in the comment section down below and sign up to our free newsletter that comes out on a weekly basis, keeping you up to date with all aspects related to prostate health and various treatments that are available for men. Now back to the video. The third reason why you may need to see a urologist is if your erections are changing. So have a look at whether or not men are waking up with erections to the same frequency as they did when they were younger. Are their erections as hard, as durable, or are you noticing that things are becoming more challenging than they have been previously? Now, the reason why the majority of men develop erectile dysfunction as they progress through life really relates to changes in blood flow. And that can be as a byproduct of changes in your sugar regulation, or potentially type 2 diabetes, blood pressure or blood pressure medication, changes in cholesterol, changes in weight, changes in level of activity that men have as they progress through life. So all of these issues are related to what's commonly termed metabolic syndrome. And the reason why erectile dysfunction is really so important to be assessed is that it can be, if you like, the canary in the coal mine with regards vascular disease, or more significantly, coronary artery disease, which can be hardening of the arteries in the heart. So if you are noticing changes from a sexual function perspective, discuss these with your local doctor and potentially go and see a urologist. Number 4 is if you're noticing changes with your testes. So if you were to notice a lump or a bump or a change in the size of one or both of your testicles, or if you had pain in a testis, please go and get this checked out. You know, the majority of changes that we see from a testicular point of view, the majority of them are benign, but that depends very much on the age of the individual. And certainly if a younger man develops a lump or a bump or something that's irregular within one or both testes, this is really important to go and assess ASAP to make sure that there is nothing more sinister at play. Okay, the final reason to go and see a urologist really relates to prostate cancer screening. You may be aware that one of the ways that we test for prostate cancer is with a blood test, which is called the PSA test. Now, PSA stands for prostatic specific antigen, and it's a chemical that the prostate produces. Now, the PSA is usually found in a man's ejaculate fluid, but it can also be found in the bloodstream. And if men have prostate cancer, the level of PSA in the bloodstream can increase. It's really important to know your genetic predisposition, as it were. Know your family history of prostate or breast cancer, as a family history of either of these significantly influences your risk of developing prostate cancer at some stage in your life. Know your PSA, know the rate of change of your PSA, and therefore know your background risk of developing the disease at some stage. Again, if you have comments, questions, please leave them in the comments section down below. If you'd like to know more about prostate health or prostate conditions, please have a look at this video, or alternatively, look at this video. Until the next time, please take care of your prostate.